Hi, everybody. We want to welcome you in on this Friday, Friday the 13th, for those of you who are superstitious. A lot of people tweeting about that today. We want to get you updated on coronavirus and how things look based on the Arizona numbers. We always look at the data here in Arizona, but a lot of this information can be used for wherever you're watching from. Put in the comments. Let us know where you're listening in from. We hope to teach you where to find this stuff in your community as well as just here in Arizona. I'm Katie Rammel. Alongside me here, Garrett Archer, virtually alongside me. He's at home. I'm in the studio today, and we'll start where we always do with the AZDHS numbers that have just come out today. And Garrett, you kind of warned us that the numbers would be higher today or had the possibility of being higher because some state agencies might have been closed yesterday for Veterans Day. And I believe we did see that reflected today.
Yeah, we were. I was just expecting, because we've seen this every single holiday, and it's just, as you know, it's actually quite rare that we get holidays on that aren't on Fridays or Mondays. So usually it just kind of carries over from like Monday, Tuesday, and then we get a big Wednesday drop. But because this is a holiday that came out right in the middle of the week, that I figured, okay, this is probably going to impact Thursday's numbers, and we'll get a bigger number today. And that's exactly what happened. We had about 3,000 cases reported today, 17 deaths. I mean, if we have to take silver lining, our death numbers are still fairly low. Huge number of tests today, 19,211 PCR tests. One of the highest. I think this is the fourth highest testing day that is reported. And again, that could be from Veterans Day weekend. So that's sort of a rollover of 2 days of testing. And then this is the serology, the diagnostic positive. That's the total. We are still at 10% though. When you look at the numbers, I'm looking at them right now, and at about 10% is what the daily percent positive is. If you do just a simple math, it's 15%, but really it's closer to 10% when you take out those sort of the epi curve issues. So let's look really quick before we move on from this, because it's Friday. I want to just look at the weekly totals. You can see, and we're ignoring this right now because the numbers haven't fully come in yet for the week of November 8th. But just check this out. This is from October 25th, 10,000 cases, about 9,500, all the way to 15,000 cases. So that's exponential growth in 1 week right now. That's quite concerning. And we don't know what's going to happen with this next week, but we don't want to see that. This is something we want to see this bend as soon as possible, because obviously, as you can see from our last curve, this is actually about the exponential growth between this one and this one, which means unless we bend this soon, we're going to be either up or exceeding these June, July numbers within, you and I talking in 2 weeks.
Yeah. So Garrett, when people are looking at that chart and the last week is not completely filled in, when can we let them know that that number would then be complete? Sunday?
It's going to be it'll be about next Friday.
Next Friday.
It takes about a week for the numbers to really fill in. So like what we're looking at today is probably a good indication of what happened this week, November 1st to the 7th. And then around this time next week, it's going to be this week that we can look at and say, okay, this is probably now fully filled in.
So just to update everybody again, that week has almost, let's see, like 14 to 15,000 in that high week. And the week before that, if you'll hover over it to let us see the exact number. So we went from almost 10,000 to 15,000. So huge.
Yeah, it's a 50% increase essentially in 1 week. So, I mean, just you have to, that's near exponential. So we have to be very careful with that.
So as a matter of comparison, we had a record number overnight here in the U.S. in total, 150,000 cases added in the U.S. In the past 24 hours. We had 1,100 American lives lost to this reported in the last 24 hours, and we currently have 67,000 Americans hospitalized because of COVID-19. So that kind of puts it in perspective with some of the numbers we're seeing. We're also, Garrett, seeing big response from states nearby. New Mexico just announced their lockdown. That starts on Monday. That will last at least 2 weeks. Utah, so all these states right around Arizona, Utah is putting in their mask mandate statewide. They're saying that that is the best way at this point to not affect things financially, but to put in a statewide mask mandate. And then some of you who are on my Facebook page, I posted this yesterday, Chicago announcing a stay-at-home advisory. It starts on Monday and it's lasting for 1 month. They're advising at this point to stay at home, to only go to work and school if necessary. And then we have a whole bunch of schools shutting down here in Arizona. The schools list is so long. So I'm going to point you to our website to see that, abc15.com/schools. So remember, Garrett, we were sharing that page with everybody because we were showing all the different schools and the numbers of cases that they were seeing, so parents could make the best choice for their families on what to do. And now that page has the school closures, because we've kind of switched into that mode now, and these schools are starting to shut down. We went through some of the list yesterday. More happened after we ended our broadcast here. Paradise Valley included in that. I believe at the end we were telling folks about Flagstaff, Creighton School District, Glendale. So a lot of them on there. So that's the best place to find that complete list. You don't happen to have that up right now, do you, Garrett? Schools.
No, but I can get that.
It's okay. I'll just say that it's now got a full interactive map on there that one of our colleagues built and put together. So it's the best place to go to get the very latest information on those closures.
I'll pick it up right now. abc15.com/schools. This is what we have so far for the latest school transitions.
Yeah, it was becoming a lot to track for folks. So this is the easiest thing that we've built to put that together so that you could sort of see what's going on, what their plans were. But a lot of them that made that decision yesterday after their higher metrics came out in their zip code or in their school district, they just decided we will shut down until after Christmas break. Some people had talked about just closing the Monday after Thanksgiving and being able to see if any more cases popped up before the kids went back to school. But in this case, they're saying we're not even going to mess with that at all and just shut down until January. So a lot of kids at home today, mine included. So mine have been home the whole time through this, but now their school is one of the ones officially shut down until January. So we're kind of navigating that life as well. So Garrett, as we look at that AZDHS page, any other things of note that you saw on there? I saw the difference between the case count in Arizona and Maricopa County. Now we're at about 270,000 here in Arizona, about 172,000 in Maricopa County. So just a matter of perspective on how those cases look, state versus county. And I know a lot of people were asking about Navajo Nation as well and Navajo County. Are you able to highlight that in there for them?
Sure, I'll do that. The Navajo Nation is at although I don't have a graph for this, sadly, the Navajo Nation is back in the hundreds as far as cases that are being added on a daily basis. They were, sadly, they had a very great low about, in mid-September where they were, adding less than 10 cases a day, and now they're back up to 100. But a good thing as well in the Navajo Nation is we're seeing the same pattern there as we are in the rest of the state, in which the deaths are not increasing. And hopefully, I say yet, but hopefully it doesn't happen. Here's the Navajo Nation numbers right now. 187 new cases in Apache County. The majority of those are going to be on the nation. And then here in Navajo County, this is 63 cases today. And that was, and you can see the 63 to the 151. These areas are having, 23 to 100. That's my apologies. I used the death number there, but 23 to 100, that's quite a high percent positive for these counties. Double-digit percent positives right now coming out of those counties.
Okay, so wanted to just take a moment with that. The next thing that people are concerned about is how our hospitals are looking. And I love your Twitter updates in the morning, Garrett, because it helps to give us kind of an overview of how those numbers look throughout Arizona. We are seeing some of these metrics tick up.
Correct. So right now, we'll start with the ICU beds. As you can see, the headroom, which is just basically the basic capacity for all ICU in Arizona. It's gone up since September, but it hasn't exceeded where we were in July, the late July. It has gone up, but it's stayed fairly level. However, when you look at the actual ICU number of COVID-19 patients, that's gone from about less than 10% back in September to 20% today. So it has doubled since in the last 2 months. When we look at inpatient, it's basically the same pattern. You can see the headroom is approximately the same. The hospitals did not sort of go down in capacity and then ramp it back up. They sort of stayed where they are. But we're in the same situation. We're about 6% in October, and now we're up to 16% are COVID-19 patients. And emergency rooms, you can see this one has also increased 36% or so in late August or early August to about 48%. But as you can see, that the trend line for this graph is very gradual. And we can actually look, that's all emergency room patients. So if we look at this one right here, we can see with the COVID-19 emergency room patients, we can look at it, it is increasing. It was at a low of about 680 on September 23rd. And it's not quite doubled since then, but it's near doubled since then.
So obviously the response to people checking into the hospital and what can be done as far as therapeutics go is of concern as well. And we do have an update on that actually just came down a few minutes ago. Well, I should start with this. It is likely that 2 vaccines and 2 therapeutics are going to be granted emergency use authorization before the end of the year. One already has for therapeutics, but this has help the markets today. We've seen the markets go up as well. So people are responding positively to that news. How that affects you right here at home is that 4 vaccines are heading into phase 3 trials. If you are able to sign up and be a part of the research, they're looking for folks here in Arizona. So cctresearch.com is one of the places that is locally looking for people to sign up and join these trials and try to be part of finding some sort of solution to this. So thank you to producer Carrie for adding that on the bottom. There's the website for you, cctresearch.com, to learn a little bit more about how you can help be a part of the solution. And President Trump just announcing that from the Rose Garden just a matter of minutes ago. I think maybe some of you are watching it over there on our this very same live feed on our Facebook page as well. So hopefully there will be some more therapeutics for those folks in those numbers that you're showing us, Garrett, of how many people are hospitalized right now across Arizona. When we're looking at some of the projections that are coming out for the next few months, I know some of the places we're updating as far out as January. Which ones are you liking right now as far as their methodology, Garrett?
I am going back to using the University of Washington's data, which I have shared right now. And there's a couple of reasons for this. One, my favorite MIT model, this was run by one person, and for some reason it stopped updating. So I have to move to another model. And I think University of Washington has done a very good job refining this model over the course of when the pandemic was really at its height. And it has been more accurate over the past several months than it used to be. I did not use this model back in June or July. But now it's much more refined, so we can use this.
And it's going all the way out to March 20th, it looks like?
Yes,
wow.
Yeah, it goes into March. And you can see, so this is their projection of total deaths in Arizona. Right now it has us at about 6,300. It does project that the very end, it's going to be at about 16,000. But you also have to look at this from an angle of the negative or the plus or minus error bars. It could be anywhere from 11,000 to 26,000. So that's a pretty big, as you know, with projections. Yeah, with projections, the farther out you go, the wider the variation of what they think is going to happen. So, you know, that's one of the reasons why a lot of models don't go out this far, because, you know, I mean, we can say 16,000 people are going to die in Arizona from COVID-19 on February 28th, but really it's anywhere from 11,000 to 26,000. So that's really not something we should, you know, really responsibly report on. That's why we sort of like to keep it within the last month or so, because this is probably a more realistic range, and it will fall closer in this number, like in this December 20th, where it says about 9,000 or so would be. So it's saying we're going to lose about 50% more by December 20th. Hopefully, God willing, that doesn't happen, but that's what it's saying.
Yeah. So I see at the top, and we've looked at this model before, some of the different scenarios are plugged in there. Do they add any scenarios if we do like mask mandates statewide, something like that, some sort of change that's made here in Arizona to try to save lives?
They do. I'm going to take out mandates easing because we know that's not going to happen. So let's stay with masks. So this is a universal mask policy. I have to really search into this, and I think it would be more enforcement in Arizona than anything else, because realistically, the vast majority of our counties already have a mask mandate in place. It's the question of how many, you know, what's the enforcement like? You can see there is a pretty big divergence in these numbers when you look at this masking. You know, it's very similar now, but as time goes on, it says basically when we look at those really far out projections, The difference is 4,000 in this number. So the current projection, 16.7 thousand. The universal mass would bring it to 12.6. So that's something to consider, at least in the projection.
Yeah, it seems like a very easy thing to do to try to save either your own life or the life of someone else out there. I mean, that difference is astounding.
Yeah, and we can see this in the other numbers as well. So when we put the universal mask on here as well, you can see it assumes, and this is pretty standard with anything that when we discuss COVID-19, the models align for about 2 weeks, and that's that's because it takes about 2 weeks to really get an idea of what's already happened. So as you can see, this says, okay, if we were today to start really enforcing universal mask mandates in Arizona, the numbers of deaths, the daily deaths, would likely continue for about 2 weeks on the same trajectory, and then it would start to peel off pretty dramatically. And that's going to change as time goes on, but that's what it says, because again, it's this 2 week number that they're using.
Yeah. Some of the other things that we wanted to update you on as well, some news coming out of ASU. I know we tend to update sports a lot on here, it seems, but COVID has had a pretty direct impact on sporting events as well. ASU announced this morning, and Herm Edwards, I believe, had a joint statement on his Twitter account, if I'm not mistaken, but that he has now been diagnosed with COVID, and several other coaches, in fact, 6 in all, and some players. So they will not be playing on Saturday. As a Sun Devil, we were disappointed to hear they wouldn't be playing, but of course wish them a speedy recovery in all of this. So ASU not playing their game this Saturday as scheduled. Speaking of ASU, Garrett, you were kind enough to share your experience yesterday with getting a test recently, and I said I had just gotten a test as well. I did the ASU saliva one, and I have to share with you guys, when you drive through, I've done the saliva one over there twice throughout this pandemic. Now, have you done any of the saliva tests, Garrett?
No, I've never done the saliva test. No.
So when someone tells you you have a small vial that you're given, and you're supposed to spit through a straw, and there's a video on it on their page, but sometimes people find that when they get there to go take the test, it's like when you're told to spit, you seem to somehow then have no spit. So what they have done is added a video on their page of people slicing lemons and limes, so that when you're sitting there to take your test, you can watch a video that makes you actually get more saliva in your mouth. And it's even got a disclaimer under it that says, don't watch this video at home before you go over there, because it lessens the effect. So ASU has really focused on going to the psychology behind it and saying, don't watch this lemon slice video and lime squeezing video until you're right there in the parking lot and having to produce the saliva for the test. So it's a creative way to employ all the fields over there at ASU to work on the psychology behind that too. All that to say that their tests are coming back pretty quick. I tested at 10 yesterday morning and had answers by 10 o'clock at night. So if you're looking for a test, that's one of the places that you can go and get that test, get some pretty rapid results that are then sent right to your phone. You can check the portal and find out. Cindy writes, I definitely had that problem. It took me some time to fill the tube up. I had to get out of line and try again. Oh no, that's why they have the big parking lot there, so you can just kind of take your time. So but I thought that was creative that they added that video on, since I think I tested in July. They didn't have anything like that. See, Vicky writes, just hearing about the lemons and I started salivating. Take the test quick, Vicky. Drive right over there. Yeah, so don't watch that video unless you're sitting there in the parking lot and you're ready to take your test. But and it was negative, so that's the other good news in all of this. But if that's where you'd like to go test instead of doing the nasal test, remember that you can sign up for that on AZDHS website. It's got that pull down bar. You go to choose saliva test, and then they're adding a bunch more. They're adding more than 500 places over the weekend, Garrett. So anywhere from Page to Globe to really everywhere across the valley. So there's lots of places to sign up, 500 places over the weekend. So they're kind of doing their own little mini blitz, if you will, to try to get a bunch of tests pushed through so they can find out the real scope of this. All right. Some of the demographics that we were tracking before seem to be evening out a little bit, Garrett, when we're looking at the age groups. So we saw It was a big concern for those 65 plus. Then those under 20, we saw that age group kind of have a lot more cases. Are things even across the board again, or how are things split age-wise?
So this is an interesting sort of dynamic that we're seeing right now. It's sort of, it changes. Sometimes it's split across the board, and sometimes it's surging ahead with the under 45s. We'll just look at the cumulatives right now. You can see about 40,000 cases, and this is again cumulative, so this is over time. 40,000 cases, 15% of the cases have come from that under 20, and then 47% comes from this 20 to 44-year-old range. And we've seen sort of this staggered growth. Every once in a while, like today was pretty high growth, and I'll address that in just one second, Dina. Basically today, the under 20 did grow at a larger clip than the others, but it wasn't significantly so. Everybody was over 1% today, and this is from the beginning of the pandemic, so that's pretty significant when we have so many cases. But it was only a few points higher, tenths of a point higher than others. As in regards to what you're talking about, Dina, with Halloween, if that has an impact, it would not be voting, first of all, right now, because if it were election day that were causing this, we wouldn't see that rise for at least a week. It takes at least 3 or 4 days to process PCR tests, which are the majority of the cases that come in, and so we wouldn't see we wouldn't see them for at least a week or so, because people have to develop symptoms and then they have to go take the test. So we're talking, a good 2 weeks after the election day. So possibly next Tuesday, Wednesday, Thursday, we might see something impact from election day. However, as in regards to Halloween, I mean, that's anyone's guess in many ways, because we are sort of in that time frame where if cases were to be increasing because of Halloween, it would be now and not, say, a week from now or 2 weeks from now. So my answer to you, of course, is that it's probable that Halloween has had something to do with this, but it's very difficult without proper contact tracing to really tamp that down and say we can affirm that X amount of these cases are from community spread on Halloween. That's something we can't do without contact tracing data.
Contact tracing would be so incredibly difficult right now with this high number of cases each day. I wonder how much of that's even going on at this point, how much they're able to
we don't have access to any sort of data for contact tracing from AZDHS. So if they are doing contact tracing and the counties are doing it, we don't have anything. They don't produce anything that allows us to figure out what's going on. So we'd have to wait for AZDHS or Maricopa County Health or someone to make a statement saying, oh, we have X percentage of cases that we can verifiably say came from community spread on Halloween or Halloween parties or something like that. But without that information, it's difficult to say.
Yeah, there were so many different things. Either way, it seems that the stores are now responding, as we reported to some of you last night who are watching. Costco has decided to enforce its mask mandate across the United States. So not just in the cities where a mask order was already in place, but everywhere. They're saying anybody 2 and under is okay. So if you have a baby or a toddler with you, they're going to be okay. But 3 and above, they've got to be in a mask inside a Costco. And we also talked about some of the product limits that are going into place to make sure that everybody has what they need when they go to the store. So you're probably starting to see some of that. They're saying, no more than 2 or 3, whatever that is, that goes for the sale in the store as well as online purchases. So just make mental notes of that if you're heading out to go shopping before the holidays and you want to make sure you have everything you need. Garrett, any other surprises in the numbers that came out today, or anything else that drew your attention?
I wouldn't say surprises. I think the reality is that
we're in this.
Where we are is we're in a consistent pattern and a consistent trend line, which means surprises are hard to come by right now. And we see that with, say, like the RT. You and I were talking about this just before before we jumped on here, on how if you look at our rate of transmission, which is about 1.13 right now, and it was 1.18 yesterday. What has been most consistent about this RT number is that it has been above 1.1 for about 2 or 3 weeks now. And because our tests are coming in at a much faster rate than they used to, this is likely a much more accurate representation of what's going on than it was in the first surge. So I think it's really it's not anything surprising. It's just what we're seeing is we're seeing consistency, and what that means is that the best thing for us right now is for us to find a leveling. The cases have to level off because the hospitalizations and ICUs are not going to level off before the cases. So we have to start seeing a leveling off and a consistent decrease in case numbers, and then it would start to impact everything else.
One of the other, we were talking about testing just a minute ago, Garrett, and where people could get their test here in the Valley. Also, people have been interested in antibody tests, and I just want to remind you, when you're donating blood here in Arizona, there are a couple of tests that are run, and one of them is a free antibody test. So when you're donating blood, they're going to let you know if you have the antibodies for COVID-19. So if you were looking and you were curious for a free antibody test, and you're one of the groups that's able to donate to the Red Cross or to Vitalant, they do run that. I've actually taken one of the antibody tests, but it was through Sonora Quest. By the way, speaking of Sonora Quest, any more information from their portal and their list of info that they give out on their site? I want to present this with the understanding that this is not the only place that tests, but it does
about
test
80%. It's a massive number of our tests here.
Yeah.
Let me check. I've got it pulled up here. This is their daily dashboard that you can check to see, and this is the only place where you can go and see sort of age breakdowns is from Sonora Quest. Because we don't have that on we don't have these under 5 breakdowns on our AIDS and DHS website, so you really have to come here to see that. And you can see right here, the overall positivity rate is up to 14%. You can see that, if you look at these numbers here, you can see this is their daily or their positivity rates by week, and this is what we're talking about when I was saying it. It's about 10%. I know sometimes you'll hear in the media saying, oh, it's 25% today, 30% today. Well, that's a much more accurate number of what's going on because there's no administrative noise in there. So really, it's about 10%. And you can sort of see these breakdowns. You can see, the numbers that are coming. These are all cumulative. It looks like about 2,200 people under the age of 5, have been tested positive at some point in this entire thing. But this is I think we have it up there, sonoraquest.com/latest news. This is available every day, so you can go and look at it.
Yeah. Gabby writes, in my opinion, we don't know all the factors at play with COVID-19 at this juncture. We learn more weekly. Isn't that the truth, Gabby? That's why we're on here so often with you guys, and now back to every day, because we are learning so much more. Garrett, I think of the things that that we could gather in March, in February, when we first started reporting on this, January 17th, here at ABC 15, how much we've learned in the months since then, and how much more data we've collected. We're only as good as the collection that comes in to sort of read and interpret that, and each month and each day we get more and more. I mean, for you to say at the beginning of this that there were 19,000 tests that came in today, boy, we would have had to wait a week or more, 2 weeks for that in May.
It would have taken a while for a day. Back in June and July, it would have taken a week or two for any one given day to fill up to 19,000 tests. So we're definitely doing better as far as tests coming in at a regular interval. Just in the vein of what you're talking about here, this is one of the interesting graphs. This is the mobility graph. I don't show it that much, but this kind of shows what might have been going on here. You can see that as soon as it pops up, there it goes. This is what our mobility index using anonymized cell phone data, and you can see we hit a low here in August, and if you recall, that was also we were beginning a very steep decline in case numbers at that time, and then we began a pretty steady increase. And because this is about a 3-day lag, our mobility value right now from October or November 10th is a 70. We're about 70% of movement on any given day. That's what it's trying to tell us. But you can see we had a pretty significant increase here. We had a corresponding decrease. It's going to be interesting to see what happens. This is an averaged line, so I don't know if we're going to see this continue to increase up, but this might be one of those things to see this start to bend, and you can kind of see, if you really look, you can see it does have a slight sloping to it, where it's no longer going in this diagonal direction upward, even though it's got these two peaks. it's actually starting to bend a little bit. And this might be like a good indicator that we might be getting ready to hit a leveling off in the next week or so. Simply because this is the amount of movement people are going from their house, and it looks like people are starting to, bend down a little bit and not, move as much as they did in the last couple weeks.
Stephen writes, are there any records of people testing positive for COVID-19 after they already had it once before? There are cases of that, but Garrett, I don't know if I've seen anywhere keeping a static, like a count there, if you will, on how those numbers are. Have you seen that compiled just
I
yet?
have not, and I honestly don't know if I don't think AZDHS or any of our health departments have announced something like that. The system that we report cases is designed for one person, one positivity rate.
Right.
So if someone is in that system and then tests positive again, I don't know how they're going to handle that or how they are handling that if it has happened, because really, it's difficult to know how they would do that, because it's a medical billing record essentially. So they can't duplicate a person. So I'm just not sure how that would happen yet.
Yeah, how that's going to show up. As soon as we do see it, we'll pass it along to all of you. And then there was another really interesting comment just a second ago. I'm on a different computer today, so it takes me just a second to scroll up. Deborah writes, we can slow this down through personal accountability, and way too many people here are not willing to do what we all need to be doing to stop the spread. So that it's such an interesting conversation, Deborah, because it really is about a public message here, if you will, Garrett, to sort of implore people to think about each other and not just about themselves. I hear so many people saying, well, I'm young, I'm healthy, I'm this, I'm that, fill in the blanks. Then they're not as concerned for their own situation, but sort of creating a community focus, and some other cultures and communities are doing that better just by nature. But how do you then sort of bring that about here to keep people thinking about each other and being able to still keep the economy open? The governor of Utah did a really good job sort of explaining the mask mandate today, that he believed that it wouldn't affect finances too much, but it would still, the economy of the state, but it would still encourage people to watch out for one another and to wear a mask. And he sort of attributed it to like wearing a seatbelt. So a lot of people will say, like, it's so easy to buckle up, and we all do it, and it's so important in making sure that somebody doesn't accidentally kill you or you accidentally kill them when you're out in a car. It'll be interesting to see if we have that sort of situation here. But how do you get a whole community response to care more for each other?
Yeah, I mean that's
Tough.
a very interesting question. I mean, we this is just me speculating, but us Southwesterners are very individualistic. We have a very libertarian streak in Arizona and in other Southwest places, and that's just it's kind of ingrained in our culture here. So I can see it how there's some difficulties there.
Yeah, Vicky Jones writes, mask it or casket. Yeah, I've seen people post that a few times. It's about protecting yourself and protecting your neighbor as well. Let's see. Okay, I want to make sure we talk about the weekend coming up, Garrett. Obviously, today was a really, really, really high number, and yesterday was a little bit lower. So if we average out the days, are we at about 2,000 each day? Is that what we're getting in on average?
I believe so. Let me look. I actually have that. The number, we're at about 2,100 when you average out the 7-day.
Okay.
Average right now, and that's going to increase, no question, because we're getting these 3,000s, and those are always going to impact our case average. Now we have seen some different patterns as of late, because numbers are coming in faster and more. They're coming in more efficiently. I guess we're not seeing as much lag. So there could also be a possibility that Saturday is going to have a very, very high number, because that's Friday's numbers, when you look at, what they're reporting. So, we may not, it used to be that today was sort of the worst of the high day is either Tuesday or Friday, and then Saturday would be a little bit less, and then Sunday would be much less, and then Monday would be much less. But that pattern's kind of broken now. So it'll be interesting to see what happens on the weekend as far as our case numbers. They could be fairly high. I mean, we're getting to the point we've got a couple 3,000s. We even have a 3,500. And we don't want to see that. If this pattern continues, we're likely to see 4,000s next week.
Yeah,
That's going to happen if the pattern continues.
So we should expect maybe sort of the same delay in reporting over Thanksgiving, or that Thursday, Friday will sort of set up the same sort of system. So thank you for putting together all the numbers and letting us see how that number looks averaged over the week, because that helps us better understand, instead of sort of riding the roller coaster in all of these numbers that come out each morning. All right. So what else will you be watching besides just that case count over the weekend?
I think as the hospitalization numbers are the most important right now to me as well.
Mm-hmm.
Those numbers to see what sort of movement they have. If the rate continues to climb at what they are climbing right now, which we do unfortunately expect that we'd see the similar climbs in ICU and in inpatient beds. We're starting to see hospitals getting worried right now. This is something that even amidst the case increases we didn't see before, but now we're reporting that some hospitals are getting worried as far as their ability to handle capacity as these things start to increase. And the other thing, of course, is the COVID-like illness syndromic surveillance. That I think right now is crucial because, and in many ways it's crucial because really observing this and how effective it is really going to tell us if the government's response, because if you remember, the government basically said that you need, we're recommending that if all three hit a certain level, that's when you go back to substantial. And while it's obvious that by next Thursday, when things recalculate, that the two, both cases per capita and percent positivity rate are going to start being over 10%. Both of those will now be into substantial coming up very soon.
Yeah.
And so now it's the CLI. So what's going to happen with the CLI? Is it going to go up to 10%? We only hit 10% on our CLI, I think 1 week, and that was in June or July, and then it started decreasing again. So I don't know what's going to happen, but that's becoming a more crucial metric by the day.
Yeah. So I want to tell everybody where they can find that CLI number. It comes out on Sundays. So we're not here with you on Sundays, but where can they find that? It's at 4% currently.
So when you go to the AZDHS dashboard, this recalculates every Sunday. You can go to hospital COVID-like illness and this illness surveillance. And this shows you where things are. You can see, like, for example, the CLI for inpatient is now at 5%. 3.7%. There's almost always a decline right here, so just ignore this number. Always go to the week prior because everything is recalculated. So at about 5% right now, and this is where we were at the very top, 21%. And we'll see what that happens if this continues to. You can see it has not been rising at the same clip as everything else, but we are now starting to see stronger rates of growth in these hospitalizations. So I don't know if this is going to get above 10%, but it's going to be a crucial metric going forward.
It'll be 5% on Sunday?
I'm sorry?
You think it'll be 5% on Sunday?
Yeah, I mean, just based off, unless the metric is not worth anything, it should be it should be higher, simply because we are seeing more of all of those inpatient, ICU, and emergency room visits. We're seeing more COVID-like illness increases in that reporting metric. No, these are two different metrics. These are reported differently. This is sort of an algorithm that is used by the CDC. It's been developed and been used for years for flu-like illness, and now they repackaged it for COVID. And basically, it's going through all of the hospital records for those symptoms, and then picking up probable COVID-19 numbers from those symptoms. And then you have the other reporting, which we do, which this is literally reporting patient by patient. And so because they are so similar, technically the rise here should mirror the rise in COVID-like illness. So, and we are seeing, like you can see, an obvious increase in rate here for these inpatients, and we'll see if that's reflected in the COVID-like illness on Sunday.
Okay, so I want to get to some of the questions that are coming in, and I love that we're back on here with you guys every day because we have a little bit more time for this. Oh, and I'm missing his question. It's cut off on my screen. Can you read it?
Do we have any data? Eaton is asking, do we have any data on people getting COVID who have been wearing a mask? We do not, Eaton. That would be a contact tracing data point. And as we said, I don't have any access to contact tracing data. That is something that the AZHS, if they decide to release numbers or a report on how many people got COVID from not just, so obviously, really quick on community spread, the majority of these cases are coming from people bringing COVID home, and then it spreads into the home and then spreads farther out from there. That's how it typically works. But as far as like, it's those sort of those contact points from mass, you know, do you see that in like the grocery store? You know, people getting it, you know, COVID-19 wearing a mask in a grocery store. I don't have data on that because that would be from AZDHS or Maricopa Health or any other county health departments.
Yeah, and one of the things I want to remind folks of, it's a philosophy that's been introduced in all of this, the Swiss cheese model, that each step that we take protects us. So if your mask is not protecting you, staying 6 feet away is protecting you. And if staying 6 feet away isn't protecting you, it's all these methods that we have to put in place in order to stay safe. That nothing, just like not having a baby would be the very same situations. The methods of protection, the more you have, the higher percentage rate, you're not going to end up pregnant. So same sort of application in all of this. It is called the Swiss cheese model, for lack of a better example there. Okay, Stephen writes, and I'm sorry, I still can't see the comments on the bottom.
Are there any records of people testing positive for COVID-19 after they already had it once before? And I think we did go over this. We don't know. Because the system is set up for one person, one positivity rate, and unless AZDHS or any of the county health departments announce that they have a second positive, we just don't have information on that.
Yeah. So, and someone else asked about some of the schools shutting down. They are starting to shut down. Let me see if I can scroll back. I still can't read the comments on the bottom. I'm gonna have to.
She says, why are schools turning red on the Maricopa dashboard when the new guidelines say all 3 benchmarks must be red? The simple answer to that is that the Maricopa County schools dashboard does not follow those guidelines. Right. They follow the original guidelines, which were one of the metrics goes above a certain threshold and it turns red. So that's why you're seeing that. You're seeing this flip to red on these because it only requires a case per 100 to go over 100 or the positivity rate to go over 100, and then it would flip to red, and that's what you're seeing.
Diane's asking, more testing means more positives. What % require hospitalization? So the testing doesn't mean more positives. It's just the positives are out there and they're detecting them. The second part of that, what % require hospitalizations? Currently, Diane, in Maricopa County, it's at 8%. It was at 8% yesterday. I didn't check it today. Usually it's between 11 and 8%. So if we just, for simple math terms, go with 10% and you see, you know, whatever number you see, take 10%, and you can figure that many are going to end up in Arizona hospitals in a very short time if that percentage follows the same throughout this. So,
yeah, and also remember that, like, for example, and I'm pulling my calculator really quick. So, like, if you look at that 8% is correct, but if you start to break it down by age groups, for example, which I've lost the ability to do for some reason. Oh, because I pushed my numlock key. Sorry, I'm a keypad user, and when you look at this, so 40% of people over the age of 65 that are those are hospitalizations. So 40% of the hospitalizations come from that over 65. So that's something to consider, that when you're in a different age group, that number goes higher. It's 8% total. But in the different age groups, like, for example, in like the 0 to 44, the number that require hospitalizations is like 0 to 1%. But when you go up to 65, that number goes to like 14, 15% very quickly. So that's something to consider when you're talking about hospitalization numbers.
Okay. We are very quickly running out of time, and I hear your dog co-signing on your comment there. Was that the dog?
Yeah. One of my dogs.
I just want to get a couple quick things. Cecile's asking, can you post the schools that are closing? Yes, Cecile. Those are all posted over on abc15.com/schools. You'll be able to find that information right there. We're updating the list as fast as we can. If you are in communication with your school, and you've heard they're closing, send the email over to us so that we can go then work to verify that and get confirmation from the school so that our list is as updated as it can be. Send that email to share@abc15.com, and then we'll work to to verify that independently and then add it to our list as well. So, and now I'm seeing a ton of questions pour in that we're just not going to have time for, but, and you're so welcome. You're welcome, Margaret. You're welcome, Cecile. Thank you for joining us on here. We'll get to more of the questions in the next week. We're back with you guys every day. That was one of the questions as well. We're back with you here each day. So we're going to keep you updated on this situation as these numbers grow. We just had to take a brief break to put our number skills to the election. And now we're back with you again. As I mentioned, Garrett's Twitter account is going crazy. If you join over there right now, thousands are joining at the moment. His account is Garrett_Archer. He'll still continue to give the updates throughout the weekend, so we won't leave you entirely. I'm on Twitter at Katie Rammel. If for those of you who prefer Facebook as your method, that is facebook.com/news from Katie. Then all of our reporting, we've got newscasts coming up at 4, 5, 6, 9 over on the CW, and then back at 10 on ABC 15. All of our reporting, in case you miss it, on coronavirus is abc15.com/coronavirus. You can find all of that there. Hey, I'll jot down some of these questions that we didn't have time for, and we'll try to get back to some of them next week as well. Garrett, any final thoughts?
No, we'll have to watch what happens with that CLI on Sunday. That's what I'm watching most.
That'll be the big one, because that is going to affect a lot of schools. So, oh, Vicki, thanks for the kind words. We're glad to be back every day too. She's writing, so glad you're back again every day. And Steve's writing, thank you to all of you. Thank you. Thank you. Okay, be safe out there, everybody. Mask up, and we'll see you back here next week, same time, same place.